Hi everyone, today we're going to review how to take the patient's blood pressure using the two-step method. So first we want to make sure that our patient is comfortable with the arm exposed and level to the heart. Then we want to locate the brachial pulse. Remember that it is ring finger up to the antecubital fossa. Use 2 to 3 fingers to palpate. Sometimes I like to place my hand underneath the patient's elbow to hyperextend, and it allows me to palpate the brachial artery a little bit better. Next, we're going to wrap the cuff around the patient's arm. We just want to make sure that the artery marker is pointed towards where we initially found that brachial artery. We want to make sure that it's wrapped relatively snugly around the patient's arm. And the meter can be placed anywhere. You can clamp it on the blanket if it's comfortable. You can clamp it in that little area there. You just want to make sure that the cords or the tubes are not all intertwined. Next, we want to locate the radial pulse. Remember that it is thumb side of the inner wrist, 2 to 3 fingers. Do not use your thumb to locate this pulse. And then we're going to look for the baseline systolic pressure. So we're going to pump and feel until we can no longer feel the pulse. So pump, feel. Let's say at about 130 is where we stopped feeling that pulse. So we can release the valve all the way to 0. We can place our stethoscope on top of that brachial artery. And now we're going to pump about 20 to 30 millimeters of mercury above the initial 130 baseline that we pumped to earlier. So this time we can pump a lot faster. We pumped up to about 160, and then we slowly release the needle and listen for the first sound, which would be the systolic blood pressure. Continue to control that needle. We want it to continue to move. And then the last sound would be the diastolic blood pressure. And that's it.